So we just have 20 minutes to talk a little bit about eyeballs and foals. And with that being said, you guys, I mean, given the stuff that we've seen today and what you guys see in your daily life, you know, working with horses, I'm sure you'll probably be fine with everything I'm going to show. But that being said, some people do not like eyes. And so this is all about eyeballs. So if you get squeamish around eyes, there are going to be diseased eyeballs coming up on the screen. So feel free to step out. I don't do people. I don't know if anyone else in here does. So, you know, just take care of yourself. Okay. So first I thought, if I can get this to advance, that we would just talk a little bit about anatomy, just so we're all talking about the same things. This is a diagram of an eye, right? Kind of cut in half. So we have the eyelids, upper and lower eyelids. We have the third eyelid, right? Which we know dogs, cats, horses, cows, they all have those. And they can kind of come up and cover part of the eyelid or the eyeball. You know, and if you don't know what that is, you might say like there's something foreign in a horse's eye. Conjunctiva that comes on the bottom of the eyelids and then around covering the sclera or the white part of the eye. It's pink normally and usually very, very thin. So a horse's sclera can be white, can be pigmented or kind of spotty. That's normal. And the conjunctiva is usually not really visible until it's inflamed, which we'll see in some pictures. And then we've got the cornea, right? The clear part. That's kind of the windshield of the eyeball. Between the cornea and the iris is the anterior chamber. There's just some liquid in there, basically fluid. The iris is the colored part of the eye, right? So if you have blue eyes, you have a blue iris. Same with a horse. Most of them have brown irises, right? But sometimes they can be blue. And then in the middle of the iris is the pupil that we look through. Directly behind the iris, kind of through the pupil, is the lens. And that's the focusing part of the eye, right? So if we're talking about cataracts, which we'll talk a little bit about, those are in the lens. And they're basically opacities of the lens. Behind the lens is the posterior chamber. It has kind of jelly material in it. And then the very back of the eye is the retina that has those fancy specialized cells that basically interprets light and shapes and sends that information up the optic nerve to the brain, which is how we and animals see anything, which is pretty cool. So translating that to a horse eye, this is not a foal, this is an adult horse, but I think a good image of a normal eye. So obviously we have upper eyelid, lower eyelid, third eyelid in this horse. The leading edge or the edge of it is pigmented. Sometimes it's pink in paints and non-pigmented horses. Brown iris, pupil here in the center, corpora nigra, which is kind of the sunshade that covers over the top of the pupil. It's pretty fancy. They have their own like visors in their eyeballs. And a difference between a newborn foal and an adult horse's eye, probably the biggest difference is the shape of the pupil. So in a foal, a newborn foal, it'll be round. And then over 5 days-ish, it'll kind of change to this oval shape. And then the cornea, obviously we can't see in this picture because we're looking through it. It's clear, it's normal. We have a couple artifacts here with some light reflecting off the cornea and then reflecting off the lens here. So normal eyeball. So signs of an eye problem in the foal are going to be pretty much the same as an adult horse. So we'll just briefly go through them. Squinting or holding the eye shut. We will talk a little bit later, but I'll mention it here. Systemically sick foals, weak foals, are going to be way less likely to show you that they have an eye problem. So if they're weak in general, they might not, it might not be as obvious that they have an eye problem. Swollen eyelids, tearing. Clearly this horse has a lot of tears happening and a lot of kind of goo from conjunctivitis in this eye. And then, so this is a great image of some really angry conjunctiva and sclera. And so you can see all this pink, you know, kind of red, right, from inflammation. You can see the conjunctiva over the sclera here. This horse has a blue iris. And so you can see really well these vessels that are actually on the cornea reacting to all the inflammation in this horse's eye. Excuse me. This is like a little like sneak peek. So we also have some hemorrhage in the iris here. And then this yellow staining, I said that this horse has a blue eye, but it doesn't look blue, right? It looks yellow. And that's from serum staining because of all the inflammation, those blood vessels get leaky. And so stains things. So I don't have, this isn't a uveitis talk, so I don't have the before and after. This is the before, but after some treatment and calming down that inflammation, that horse did have a blue eye again, which was nice. So a cloudy cornea, I mean, as we're talking about all these things, all of this is really color change, right? So more red than it should be, more white than it should be, could be blue, could be yellow, could be green. So those color changes are really important. Is this normal or abnormal? You know, we're looking at color. So cloudy cornea, all of these horses have different problems, but they all have a cloudy cornea as part of it. Another sign of an eye problem can be blood inside the eye. So blunt force trauma is often the cause of this, but in foals, it can be from septicemia. So if they're systemically sick and they have bacteria, you know, infecting kind of their whole body, it can present as hyphema. So it can be a little window. Other signs of an eye problem. So this is a cataract. This is a hypermature cataract in a older horse that has ERU, but it's complete opacity of that lens. And so whether it's a congenital cataract that we can see in foals or this kind of end stage uveitis caused cataract, that horse can't see through that. They can probably see light and dark, depending if their retina is still working. But if you can't see through the lens, they can't see through it out either, as far as shapes and things. Vision loss can be really difficult to determine in a horse, and probably particularly a foal, because they kind of are hyperreactive a lot of times right in the really early, like neonatal period. And especially if we maybe have a little maladaption, maybe a little bit, you know, hypoxemia or a dummy foal situation. Is it because they can't see because their brain is affected because they're a dummy foal, or do they have a primary eye problem? And so that can be something just to sort through. And then eyelid lacerations, of course, there's nothing particular about a foal's eyelid. They can get cut just like an adult's eyelid. And as I kind of alluded to, foals are sometimes different than adult horses as far as just not displaying a lot of obvious signs of discomfort if they are systemically sick. So they might not show you the squinting, the tearing, et cetera. And so color changes become even more important in these guys. So some specific eye disorders of the foal, they're kind of, I put them in kind of three overarching buckets, if you will, or categories. So there's congenital abnormalities, and we'll go over these a little bit in the next couple slides. Congenital abnormalities, inflammation or systemic illness, and how that can show up in an eye, and then trauma. Underneath that umbrella, I kind of categorized corneal ulcer, eyelid laceration, and blunt trauma. So for congenital abnormalities, I put breed associated, and I probably should have just taken that out and just put inherited because this multiple congenital ocular abnormalities syndrome, or MCOA syndrome, has been found in lots of different breeds. We do know that it's inherited. It's a genetic, genetically affected, I guess, or linked disease. And it is associated with silver color. So that silver dilution is connected with this eye problem, unfortunately. So you can, excuse me, you can test for it. So UC Davis has a test. It's another test that we're looking at a bunch of roots of hairs. So it's, you know, you can add it into, if you're testing other things, you can test for this. If it's a breed that you are, that sometimes is affected with silver colors, even if you're not shooting for that, you know, they don't have to be silver to have the disease. And like I said, there's lots of different breeds that are affected. We kind of classically think of Rocky Mountain horses, but on UC Davis's website, they have probably 25 different breeds that can be affected with this. And signs that you'll see include cataract, include iris problems like thin areas or cysts or holes in the iris. And then some retinal problems that could certainly affect vision. And then I guess I should say, you guys probably all know, but congenital just means they're born with it, right? So that's what the term congenital abnormalities mean. So then as far as, you know, either not inherited, or we don't know if there's a genetic component to them. Congenital cataracts, microphthalmia, which microphthalmia is basically just born with really small eyes that are underdeveloped, that didn't form correctly in utero. And then entropion is that's what's pictured here. So the lower eyelid is basically kind of curled in, and the eyelashes and the hairs of that eyelid skin can rub on the cornea and cause corneal ulcers and secondary problems. And this can be something that might need surgery to be corrected, but certainly in a super young neonatal foal that has this, they might just be a little dehydrated, and you might just need to give them some time. There are things that your veterinarian can do to temporarily evert that, or roll it out, that eyelid, so that it's not rubbing on the cornea, causing other problems while that foal is kind of growing into their eyelids, if you will, or getting rehydrated, which obviously you would want to be addressing as well. So inflammation, uveitis is just inflammation of a certain part of the inside of the eye. You may have heard the term uveitis in conjunction with equine recurrent uveitis, or ERU, or moon blindness, and that's not what we're talking about here. We don't see ERU in foals. So in this situation, it's simply inflammation of the inside of the eye, and in foals, it's most likely caused by some sort of systemic condition. So septicemia, rhodococcus, for example, can present as either uveitis, like in this picture, with a cloudy cornea. There are some white blood cells kind of settling down at the bottom of that anterior chamber, really small pupil, painful, if the foal will show you that it's painful, and also that hyphema, or that blood in that inside of the eye, can be a presentation of this as well. And then trauma, another situation that I guess is under this trauma category is a scleral bruise or scleral hemorrhage that simply, I mean, we have talked this morning a lot about how foaling is a traumatic experience, right? Not just for the mom, right, and for the mare, but also for the foal. So there's a lot of pressure that can happen on their eyes, and so they can get bruised, basically. And so that would be redness on the outside, on that sclera, that white part of the eye, and that generally goes away in 7 to 10 days, just like any other kind of bruise would resolve. And so that's not generally a big issue, but something that you might see. And then corneal ulcer, similar to an adult's eye, right? They can get scratched, whether it's from that entropion or from something they ran into in the stall, or hay, straw that they laid on, et cetera. And so this bright green spot here, that is fluorescein stain. So you put fluorescein in the eye, you'll see it kind of settles down at the bottom, so just in the tears, and it gets spread across the surface of the cornea, and it doesn't stick to normal cornea, right? So wherever that dye sticks, that means there's basically a wound on that cornea. There's a break in that epithelium, that covering of the cornea. And certainly it can get infected. That's kind of worst case scenario. And on the next slide, or next couple slides, I think we have pictures of infected cornea. And then eyelid lacerations and blunt trauma kind of speak for themselves, I think. So a superficial corneal ulcer, this is probably the most common problem that we see in horses in general, not just foals, when it comes to their eyes. Generally not a long-term treatment, generally a pretty straightforward treatment. And goals here is to prevent infection. So a simple superficial corneal ulcer, by definition, is one that's not infected. We want to keep it that way. So infection can really move very quickly through the cornea. It's not very thick. And so we want to make sure that we're proactive. Eyes are, if there's a problem with an eye, call your vet right away, because things can move pretty quickly and we don't want to wait and give it time. And then, of course, we want to control pain and inflammation as much as we can, both for the welfare of the horse and to hopefully keep them from rubbing their eye and causing another problem. So this is a picture of a foal that I saw for squinting. And you can see the fluorescein stain, right? Just in this whole kind of lateral outside part of the cornea, and super red conjunctiva, right? And luckily, this was a pretty straightforward diagnosis, not only of the cornea, but also the cause. And so I plucked that little plant material that was wedged where that star is on that picture. It had just punctured really right into the conjunctiva and was stuck there. So I had to kind of use some force to get it out. It wasn't just going to fall out on its own. And so every time that foal blinked, it was just scraping against his cornea. So he felt a lot better once we got that little plant piece out. So this is what we're trying to prevent, or two examples of what we're trying to prevent. These are both adult eyes, but it could easily be a full eye that could look the same. So an infected corneal ulcer can be infected with bacteria or fungus. The Southeast United States, we think more of fungus, but you can certainly see fungal infections anywhere in the country. And so in this situation, we're no longer trying to prevent infection because we already have infection, unfortunately. And so now we're trying to treat it. And basically we're in kind of a race between treating it, killing the infection before it has a chance to kind of eat through the cornea. And worst case scenario could cause rupture of the eye. So unfortunately, that's what happened with this case on the right. That's a really, really deep ulcer that basically has, in some areas along the edge, just one layer of cells left. And unfortunately, we ended up taking that eye out. But so quick evaluation and initiation of treatment is super important. We're talking about young foals, young horses just starting their life. We, of course, want them to maintain their vision and their eyes for their life. So eyelid lacerations, I'm not going to spend much time on this at all. I want to keep us on time. But just like in any age horse, right? You want to repair them as soon as you can. And like I mentioned, we're trying to set this foal up for a healthy, long life with intact eyes. And that eyelid margin is super important for protecting the eyeball, right? But also dispersing tears normally over the surface of the eye. And so if there's an abnormal eyelid margin, then it can set us up for corneal disease long-term. So really important to address those quickly. So take-home points, eye problems in a foal can alert us to a systemic disease, really more so than an adult horse. Prompt examination and treatment makes a big difference in eye problems in general. And then when in doubt, call your veterinarian. Yes. Yeah. So the question was what moon blindness is. So it doesn't affect foals, which is why I kind of cruised over it. But equine recurrent uveitis is an autoimmune disorder where basically the immune system recognizes the eyeball as foreign and so starts to basically attack the eye, which causes a lot of inflammation that comes and goes. So that's where the recurrent comes in. And moon blindness is because back in the day, before we knew a lot, the waxing and waning was kind of attributed to the moon because that waxes and wanes. And so it certainly can cause vision loss and pain in horses. So does that answer your question?
Yes.
Yeah.